working to connect a region of over 600 million bridges between our lands.
Hello and welcome to ASEAN in Focus with our EBC International coverage on liwanagin natin on the COVID-19 crisis in the world. And now to the news. UN Chief Antonio Guterres said world leaders must come together and offer an urgent, coordinated global response amid the coronavirus crisis. He also said we are in an unprecedented situation. Normal rules no longer apply. The Secretary General also said that we have a responsibility to recover better and to ensure that lessons are learned and that this crisis provides a watershed moment for health emergency preparedness. Let's listen in.
We are facing a global health crisis, unlike any in 75-year history of the United Nations. One that is spreading human suffering, infecting the global economy, and upending people's lives. A global recession, perhaps of record dimensions, is a near certainty. The International Labour Organization has just reported that workers around the world could lose as much as $3.4 trillion in income by the end of this year. This is, above all, a human crisis that calls for solidarity. Our human family is stressed and the social fabric is being torn. People are suffering, sick and scared. And current responses at the country level will not address the global scale and complexity of the crisis. This is a moment that demands coordinated, decisive and innovative policy action from the world's leading economies. We must recognize that the poorest and most vulnerable, especially women, will be the hardest hit. I welcome the decision by G20 leaders to convene an emergency summit next week to respond to the epic challenges posed by the COVID-19 pandemic, and I look forward to taking part. My central message is clear. We are in an unprecedented situation and the normal rules no longer apply. We cannot resort to the usual tools in such unusual times. The creativity of the response must match the unique nature of the crisis, and the magnitude of the response must match its scale. Our world faces a common enemy. We are at war with a virus. COVID-19 is killing people as well as attacking the real economy at its core: trade, supply chains, businesses, jobs. Entire countries and cities are in lockdown, borders are closing, companies are struggling to stay in business, and families are simply struggling to stay afloat. But in managing this crisis, we also have a unique opportunity. Done right, we can steer the recovery towards a more sustainable and inclusive path. But poorly coordinated policies risk locking in or even worsening already unsustainable inequalities, reversing hard-won development gains and poverty reduction. I call on world leaders to come together and offer an urgent and coordinated response to this global crisis. I see three critical areas for action. First, tackling the health emergency. Many countries have exceeded the capacity to care for even mild cases in dedicated health facilities, with many unable to respond to the enormous needs of the elderly. Even in the wealthiest countries, we see health systems buckling under pressure. Health spending must be scaled up right away to meet urgent needs and the surge in demand, expanding testing, bolstering facilities, supporting healthcare workers, and ensuring adequate supplies with full respect for human rights and without stigma. It has been proven that the virus can be contained. It must be contained. If we let the virus spread like wildfire, especially in the most vulnerable regions of the world, it would kill millions of people. As we need to immediately move away from a situation where each country is undertaking its own health strategies to one that ensures in full transparency a coordinated global response, including helping countries that are less prepared to tackle the crisis. Governments must give the strongest support to the multilateral effort to fight the virus, led by the World Health Organization, whose appeals must be fully met. The health catastrophe makes clear that we are only as strong as the weakest health system. Global solidarity is not only a moral imperative, it is in everyone's interests. Second, we must focus on the social impact and the economic response and recovery. Unlike the 2008 financial crisis, injecting capital in the financial sector alone is not the answer. This is not a banking crisis, and indeed banks must be part of the solution. And it is not an ordinary shock in supply and demand. It is a shock to society as a whole. The liquidity of the financial system must be guaranteed, and banks must use their resilience to support their customers. But let's not forget, this is essentially a human crisis. Most fundamentally, we need to focus on people, low-wage workers, small and medium enterprises, the most vulnerable. And that means wage support, insurance, social protection, preventing bankruptcies and job loss. And that also means designing fiscal and monetary responses to ensure that the burden does not fall on those who can least afford it. The recovery must not come on the backs of the poorest, and we cannot create a legion of new poor. We need to get resources directly in the hands of people. A number of countries are taking up social protection initiatives, such as cash transfers and universal income. We need to take it to the next level to ensure support reaches those entirely dependent on the informal economy and countries less able to respond. Remittances are a lifeline in the developing world, especially now. Countries have already committed to reduce remittance fees to 3%, much below the current average levels. The crisis requires us to go further, getting as close to zero as possible. In addition, G20 leaders have taken steps to protect their own citizens and economies by waiving interest payments. We must apply the same logic to the most vulnerable countries in our global village and alleviate their debt burden. Across the board, we need a commitment to ensure adequate financial facilities to support countries in difficulties. The IMF, the World Bank, and other international financial institutions play a key role. The private sector is essential in creating investment opportunities and protecting jobs. And we must refrain from the temptation of resorting to protectionism. This is the time to dismantle trade barriers and re-establish supply chains. Looking at the broader picture, disruptions to society are having a profound impact. We must address the effects of this crisis on women. The world's women are disproportionately carrying the burden at home and in the wider economy. Children are also paying a heavy price. More than 800 million children are out of school. Right now, many of whom rely on school to provide their only meal. We must ensure that all children have access to food and equal access to learning, bridging the digital divide and reducing the costs of connectivity. As people's lives are disrupted, isolated and upturned, we must prevent this pandemic from turning into a crisis of mental health, and young people will be most at risk. The world needs to keep going with core support to programs for the most vulnerable, including through UN-coordinated humanitarian and refugee response plans. Humanitarian needs must not be sacrificed. Third and finally, we have a responsibility to recover better. The 2008 financial crisis demonstrated clearly that countries with robust social protection systems suffered the least and recovered most quickly from its impact. We must ensure that lessons are learned and that this crisis provides a watershed moment for health emergency preparedness and for investment in critical 21st century public services and the effective delivery of global public goods. We have a framework for action, the 2030 Agenda for Sustainable Development, and the Paris Agreement on climate change. We must keep our promises for people and planet. The United Nations and our global network of country offices will support all governments to ensure that the global economy and the people we serve emerge stronger from this crisis. That is the logic of the Decade of Action to deliver the Sustainable Development Goals. More than ever before, we need solidarity, hope, and the political will to see this crisis through together. Thank you.
All right, Governor Gavin Newsom just ordered California's nearly 40 million residents to stay home, making it the first state to impose strict mandate on all residents amid the coronavirus crisis. And joining us live right now from California is our EBC Los Angeles, California Bureau Correspondent MJ Racadio. MJ.
Hi, Alma. This is MJ. I'm actually reporting in California's capital, Sacramento. And as you can see, usually this place is very busy. And I'm going to show you 360 degrees. How does it look like now? It's a total lockdown. Beginning tonight, midnight Pacific Standard Time, that the whole entire California will be locked down. So meaning 40 million Californians will stay home. And a while ago, I went all over the place. Everyone's buying their necessities, such as bathroom tissues, those important things at home. They know that it's going to be locked down. So tonight is the night, this midnight, like about an hour from now, it will be locked down. So meaning you cannot get out. But of course, those necessities such as buying your groceries, going to the pharmacy, and visiting your doctors, it's important. But other than that, you just stay home and you cannot get out. And according to Sacramento Public Health, right now, confirmed cases of COVID-19 is 45 and death is 3. As of Thursday, here in California.
So what time is it now over there? It's 2:17 in the afternoon here, MJ. What time is it there?
10:15. It's about 10:15 in the evening, California time.
Okay. So midnight is lockdown.
Yes. Midnight, you cannot get out. So the governor ordered stay at home. So 40 million Californians will stay home. Unless you want to buy important things in the store, you want to visit your doctor, you're going to the bank, you are more than likely that you can get out. But other than that, you stay home.
Okay. So are there any rules, like what if they, like if you have to go out, do they give you a penalty or something because you have to go out? Or do you have any rules now, like just one person can go out of the house per family or anything like that? Or you haven't had any?
Yes, as long as it's important matter, maintaining social distance is important. At least 6 feet per person. And that is it.
Okay. What about groceries? A while ago or a few days ago, you gave us an update on the panic buying going on in your area. How is it now? Before the lockdown, was it still the same way?
It's crazier actually today. And I went to different supermarkets, especially the big ones, in a different neighborhood in Sacramento, like the northern part of Sacramento. It's the total chaos. Everyone is buying their groceries. It's like, I don't know. It's just panic buying to the highest level.
But are there any other ways that they can do so as not to panic buy over there? I mean, do you have anything in place so that the elderly won't have to go with the crowd? I mean, you know, it's really hard for the elderly to go in. I mean, to the crowd. It's dangerous for them. It's not good for them. So, how do they cope? Or how will they cope?
Usually,
how did they cope?
You know, California has a volunteer program. So, if you can volunteer, you could help the senior citizens and the homeless. You could volunteer your time to give them food or even deliver their groceries. And with these companies, like different companies, big supermarkets, they offer online delivery.
Okay.
And of course, different restaurants, you could still order to go. or just pick up your, it's a curbside delivery. You could do that to protect yourself with this COVID-19.
Okay. So with restaurants, you pick up your food to go. You can order
Yeah.
online.
You can only do that. There's no dine-in at all.
Ah, okay. What about groceries? You said you can order online. Is this delivered to you or do you pick it up as well? How do you do that?
You can pick it up. They could deliver it to your house. It's better that way. Kind of avoid the social distance. As you know, you can still go out with a total lockdown here in California, but you have to maintain a social distance, 6 feet per person.
Mm-hmm. So it's not that bad. Only that I know.
Bad,
Yeah.
but it's just really quiet. I'm gonna have to show you the
Okay.
Capitol building again, 360 degrees. It's total lockdown.
It's like a ghost town.
It is like a ghost town
mean,
because this is.
Yeah.
It's a very busy, supposed to be very busy today. All the restaurants, usually it's a get together with families here, but now it's a total lockdown beginning midnight tonight, California time.
Okay. So how long is the lockdown, MJ?
I should say about 8 weeks.
8 weeks. And how do you plan to entertain yourselves? You, during this lockdown.
Usually there's a lot of ways you could, you could watch your favorite live stream, since there's a lot of online live stream now for TV series or movies, or just spending quality time with your family. It's really, nowadays is the norm, the culture.
Uh-huh.
And just to tell you, give you a little bit lighter, aside from this COVID-19, Tom Hanks and Rita Wilson
Oh, yes.
was released in Australian hospital. So it's a very good news.
Uh-huh. Yeah, just to let you guys know, our viewers here, MJ Recadio is also our Hollywood showbiz reporter. So can you give us a little update on what's happening in the showbiz world, MJ?
Well, right now, all the live shows, such as all these popular TV shows in Hollywood, they cut their taping. And also, singer John Legend, he did some concert online.
Okay.
So that's pretty good. Then Edris Alba, he just positive of COVID-19 as well. So all I can say is stay safe, and you got to protect yourself with this COVID-19. And if you want to go out with important things, you just maintain social distance.
All right. Thank you very much, MJ, and we'll get more updates from you as this lockdown continues.
Yes, this is MJ Ricardo from Sacramento. We live in interesting times.
Thank you, MJ. Let's get a latest update in Japan. For now, International Olympic Committee President Thomas Bach said the organization is still considering different scenarios for the Tokyo Games. However, they are still optimistic about holding this event as scheduled despite the COVID-19 pandemic. Now, what is the situation in Japan right now? Let's get an update from Tyra Lu, our EBC Japan Bureau correspondent. Tyra?
Hi, Alma. Good afternoon, and good afternoon to all our viewers.
Tyra, what time is it there?
Now it's 3:25 actually, to be exact, in the
3:25.
afternoon.
Okay.
Yes, so
And
we
what
are
part
just
of
1 hour
Japan?
ahead.
Okay, what part of Japan? In what part of Japan are you?
So right now, I'm located in the western part of Tokyo, particularly here in Hamura City. Okay. And this is actually near the border, going to Saitama already. So we are kind of, and also nearing the Kanagawa area, which is at the south of Tokyo. So yeah, I'm at the western part of Tokyo, near the Yokota Air Base, the US, the American base.
Okay. So what is the latest over there in Japan during this COVID-19 situation?
Okay. While situation here in Japan remains, more or less life goes on because Prime Minister Shinzo Abe did not see any reason to call or place Tokyo under a state of emergency or declare, or how do you call this, a lockdown for the entire country. However, it does not necessarily mean that cases remains the same. There was an increase. So as of Thursday, 6:30 p.m., there was an increase from 920 to 936 confirmed cases of the coronavirus. However, it still remains low compared to other countries. And no restaurants are closing. And schools remain closed since March 2nd. However, daycares remain open so that parents would have somewhere to leave their kids while they continue to go to work. So yeah, most of the companies are still open. However, some huge companies that who can work online are considering working from home. Alma?
Yes. So I also heard that the Japan cherry blossom season will not be open for this year. Oh, that is so sad. That is such a beautiful event. Yeah.
Yeah, it already started. It doesn't necessarily mean it will not be open. It will
Okay.
still be open, but
But-
officials actually discourage people from gathering. And as you know, Japanese, they are really obedient and they're disciplined people. So
Yes.
yeah, you would expect nobody would be going out to enjoy the hanami, well, or otherwise called as cherry blossom viewing.
Okay. But you're not prevented from going out and getting a view of the cherry blossoms, though.
Not really, as long as we will avoid crowded places.
Okay. So and social distancing, is that it?
Yes, that is right. However, the government is not very strict on this, but the heads and the officials of every company are actually strict to their employees and being very disciplined and obedient employees. So they would really abide to the rules and the circulation coming from their respective corporations.
So Japan is still busy outside. Is that what you're saying? It's like normal. It's just that the Olympics, it's the Olympics really that is the real worry here, right? If it's going to be scheduled as planned or go as planned or not?
Yes, that is correct. While they do not have any plans to cancel it, however, they're considering some preventive measures on how to how do you call this one? How to avoid any problems that may arise after that.
And so what are you guys doing during this COVID-19 situation over there in Japan? Do you have any any measures in place, any safety measures in place?
So personally, what we do is we wear masks wherever we go, and wherever you see people. Most of the people, they are actually wearing masks, especially on the trains. And we try to change routes of our train destinations. So instead of using the usual routes, so we try to change and look for some routes with less commuters.
Okay.
So, and another thing is we disinfect our homes.
Okay.
And then, as you know, there are shortage of alcohol and hand sanitizers. However, what is much important, this is according to a Japanese, according to her advice. So what is important, rather than packing up and panic buying and stacking up your closet with a lot of alcohol, it's better to strengthen your immune system. So eat healthy food so that you would be able to strengthen your body and immune system. It will be stronger to fight against the virus.
That's right. And wash your hands all the time.
Definitely.
And you've been
Yes,
disinfecting. Yeah, I know, because when I called you earlier, you were cleaning and disinfecting your home.
That is right. And one of
Yeah.
the problem, Alma, is there is actually a shortage of cleaning of disinfectant, liquid disinfectant in stores all over. And I was talking to my sister earlier. She's in Canada. She told me, like, yeah, we ran out of Lysol. I told her, hey, I got this advice from an old Japanese in our daycare center. So we are actually using this in our daycare to disinfect all the mats and disinfect all the tables and everything where the kids would lay their hands on. So it's actually very simple. So we have Clorox, right? So we have equivalent to Clorox in the Philippines. So we have this. I'm not actually promoting this, but we're actually using. This is very cheap, and it's like one liter, 1.5 liter, like kitchen bleach. So
It's
if you have a
bleach, yeah.
bleach at home,
Yeah.
like bleach for clothes, for the toilet, for the kitchen, you can actually use it. It's very effective in killing bacteria and disinfecting. So what I actually do is a 500 ml of water,
Yeah.
and then like this is a pet bottle cup. Just one pet bottle cup of this
Yeah.
one, and then you mix it with water, so you already have your homemade disinfectant. So this is what actually I'm using earlier. So when I was texting you, so it's effective in killing the bacteria.
I know. Yeah, I still remember your face, so I'm still smiling to myself here. But anyways, thank you so much for that tip. And that's the mother in us. That's the...
Definitely, you've got kids at
Yes.
home.
Yes. And how are the kids? They're good?
Now they're asleep. Yeah, they're still at the there's a hoipen. When you say hoipen, that's daycare. So my sister told me, isn't that dangerous? I mean, they're in a group. So I actually told her, you know what? I think it's safer for them to be at the daycare rather than at home, because sometimes I forget to clean, and at the daycare we clean, we disinfect the place 3 times a day.
Ah, okay.
Yes, so it's safer for them. And all parents, before you enter the daycare center, you have to wear a mask. And then there's this hand sanitizer at the entrance. Before you enter the place, you need to sanitize your hands. So yeah, it's actually safer for them to be at the daycare.
Oh, that's very good. Okay, so stay safe over there, Tyra, and say give my love to the kids. Thank you so much.
Yes, thank you so much. Yes, this is Tyra from Tokyo, Japan. We live in interesting times.
All right, thank you, Tyra. We stay in Japan. Staying in Japan, we have joining us live Lou Stefan Imelda. Lou Stefan Imelda, also from Japan, our Japan bureau over there. Lou, how are you?
Yes, good afternoon, Alma. Good afternoon to all our viewers there.
Hi, Lou. What part of Japan are you in?
I'm actually in Osaka, Japan. It's towards the southern part of Japan. Yes.
Is that far from Tokyo, from where Tyra lives?
Yes, by bus, it actually takes 8 hours, but by the bullet train, a very fast train, it just takes about 1.5 hours to 2 hours to get here.
Okay.
So it's not very far. So, well, actually, as of 3:57 a.m. today, here in Osaka, there are already 119 confirmed cases, and it's still increasing, but no recorded deaths yet. So it's that's kind of a good news.
Yeah.
But like Mom Tyra said, it's not very strict as of the moment. I just wanted to share, actually yesterday, the government of Osaka and Hyogo, a nearby prefecture, announced that we should do self-restraint because today is a national holiday. It's a beginning of a 3-day long weekend. So everyone is advised not to go out or not to do unnecessary travel within the 2 prefectures.
Ah, okay. So there are restrictions, but not as strict as other countries are doing right now, right?
Yeah, that's right. That's right. So actually, it's business as usual. Also here in Osaka, it's not very strict. Actually, yesterday I was just on a subway, and it felt like there's no virus at all. Everyone, it's still jam packed. But actually, we just try our best to wear masks all the time, disinfect all the time, because that's what our Japanese friends are also telling us. Yes.
And Japan is a clean place anyway, so, but then other restrictions in place, like for the elderly. I mean, the elderly population there, I know, is quite big. So can you tell us, are there any special restrictions or measures in place for the elderly?
Actually, there are no specific restrictions for them. Though we noticed that the daycare the nursing homes. Actually, there are a lot of nursing homes here. Actually, I go to school every day, and I always pass by this big nursing home. and it's still open. And actually, they're welcoming more volunteers to come and help, because it's better if they are protected, and some of them they don't have families who could take care of them. So some of them are taken care of volunteers who really help and try to, of course, help them disinfect and all those kinds of things. But for specific restrictions, there are no other restrictions given by the government.
That's good. Do you have any message for us over here in Japan? Do you have family here? Do you have any message for them? You want to?
Yes, I heard that there's a big lockdown in the Philippines right now, and I'm constantly in contact with my family there, and they said that it's okay not to have not to go out and so on, but it's better that if they have food, whatever happens, they have food inside, so they just buy a lot of rice and a lot of goods that they can use for the following weeks of the lockdown. Actually, in our area, they really can't go out. So if they want to go somewhere, it's not possible. And by the way, in our because the consulate of Japan there's also one consulate here in Osaka. Okay. So they announced to the Filipino community that we should refrain from going to the Philippines or going home until the enhanced community quarantine is lifted in the Philippines. So that's the advice, because we can still go home. Actually, we can still travel back home, but yeah, the consulate advised all the Filipinos not to go back home yet because of that. Some of our friends canceled their flights actually this coming Golden Week here in Japan. So yeah.
There's always a next time.
That's right. Yes.
Okay, so you stay safe, Lou, and we'll talk to our other bureau there in Japan.
Okay. Thank you very much. This is Lou Amelda, and we live in interesting times.
Bye, Lou. Stay safe. Still staying in Japan, we have Dennis Lou on the line right now. Dennis?
Hi, Alma. Good afternoon to you and to all our viewers in Asia and in Focus. Right, I have something here, right? Okay. How did we contain the virus here in Japan? It's just that Japanese quarantined themselves at home at first, right? After Prime Minister Abe ordered closures of schools since March 2nd. ALTs or assistant language teachers here, where many Filipinos working here as teachers, to include myself, of course, stopped working. And since then, only few people are seen at stations, restaurants, and other public places. Right. And here in my place right now, this is a Hashimoto area here in Kanagawa. Most people are wearing masks. I will turn around a bit so you could see. Yeah, this is the station. Yes. And right, they are also keeping hand sanitizers handy, just like the one I am having right now. Okay, it's here. Right. Okay, hand sanitizer that you could use to sanitize your hand, and also Alma, I have talked to some residents here, and they mentioned that life goes on as usual. Right. We were advised to keep our hands clean and avoid touching our faces, especially our eyes and our nose. Also, to keep away from people who are coughing and sneezing. Yeah, I think many of us, many people here in Japan follow that basic rule, actually.
I know that schools are out. Until when, Dennis?
It's still indefinite, okay, but then I got information that they will be sending emails and other forms of information to when they're going to start a regular class or so. But graduation ceremonies are continuing one city after the other, as long as, they are okay to have to hold their graduation, they do it.
So how does school continue? Is it online now, like other countries do?
Yeah, I still don't have that information right now, Alma.
It's just stopped for now until indefinitely, yeah.
Until further notice, right. But then, as what I mentioned earlier, like a resident here in Yokosuka area, like one of the residents said that life goes on. So we do our usual stuff as usual.
Is that your train coming? We're hearing an announcement.
Yeah, but it's okay. I need to finish this before going and jump on to my next train. Oh, here it is, by the way.
All right.
You take a look. And by the way, it's a holiday today, by the way.
Oh.
Today is the first day of the springtime.
Oh, okay.
And it's called the spring equinox, Shunbun no Ki, where the length of what they call this, the night are the same length as in the morning, the day.
The day. The night is the same length as the day. Oh, wow.
Yes, that's the day. Right. So yeah,
It's supposed
it's a
to be
nice
busy.
weather here.
Uh-huh. Oh, there you go. So are you supposed to
Yeah,
go in the
stay
train
safe
now?
there.
Do I have to let you go? Okay, thank you so much, Dennis.
You're welcome. You're welcome.
Thank you, Dennis.
Thank you. Stay safe. Bye.
Stay safe. Bye. Okay, Dennis Liu reporting from our EBC Japan Bureau. Let's head on to New Zealand. Our EBC correspondent, Greg Besa, is joining us live. Greg? Hello, Greg.
Hello?
Hello. Hi, Greg. This is Alma. How are you over there in New Zealand? What is the situation over there now?
Good evening.
And
Good
what
day,
time is it
Alma,
there?
and all
Yes.
our viewers out there and all over the world. Well, in New Zealand, it's now 7:42 p.m. of Friday, 20th of March. Now, in New Zealand, in the past 24 hours, the government has informed the general public of the following major developments. First, they confirmed that it has now 38 COVID-19 cases all over New Zealand, 5 of which are here in Wellington City, the capital of the country. Second, the government has closed the borders from all foreigners, arriving foreigners, as of midnight of last night. So all permanent residents and citizens are the ones being allowed to come to New Zealand, but they have to submit themselves to what they call self-isolation for 14 days. Then another major development is that the government has issued travel warning at the highest level, meaning to say it encourages all New Zealanders traveling abroad to come home as soon as possible. And then the other major development or directive of the government is that it is now banning all gatherings except those from schools, transportations, and supermarkets of events of more than 100 people.
Okay.
But so far, there's no lockdown, Alma.
Okay.
Everything is fine as it goes on. And then, well, of course, panic buying is unavoidable. But the government of New Zealand is encouraging the public, it's not time for panic, but it's time for preparation. So we are being encouraged to prepare for any eventuality as far as the coronavirus is concerned.
I saw your picture once. You were in a supermarket, and I guess you ran out of toilet paper?
Yeah, I mean, it's a common thing, I think, across the globe. Toilet paper and then sanitizers and other things, what they call as basic things that the people need in terms of emergency. But again, the government is doing its best to calm the public of not doing the panic buying. So all supermarkets here in New Zealand are, once it's being, the products are gone or being bought by the public, they are being obligated to replenish it, to supply it again. so that the people will not be panicking. So in order also to control the buying spree of the people, they have to put some limit of those necessities, like the toilet paper. They're only required to buy at least one, sanitizer at least one per customer, and of course the bread as well. They have to put a limit in buying.
All right, thank you very much. And we'll get more updates from you as this situation, this COVID-19 situation goes on. Greg?
Yeah, thank you, Alma. This is Greg Bessa from Wellington City, New Zealand. We live in interesting times.
Thank you, Greg. From New Zealand, we go to Australia. Prime Minister Scott Morrison warned that Australians will face at least 6 months of disturbance to day-to-day lives as they navigate the coronavirus pandemic. Let's verify that and get the latest from our EBC correspondent, Emmy Kapili Taroja. Emmy, how are you?
Hello, Alma. I
Hello.
hope you're hearing me clearly. That is very right. We are expecting changes in the daily lifestyle here in Australia as preventive measures are being implemented. And recently, just today, as of 3 o'clock in the afternoon, Prime Minister Scott Morrison has delayed the federal budget and ordered limits of 1 person per 4 square meters in indoor venues and warned further domestic travel restrictions are coming. So, Mr. Morrison also confirmed the National Cabinet had agreed to cap, again, of 1 person per 4 square meters for indoor gatherings, including in pubs, cafes, and restaurants, as was recommended by Australia's chief medical officers last week. As we can remember that there was already a limit of no more than 100 people for non-essential indoor gatherings that is being enforced here in Australia. And for outdoor gatherings, a limit of no more than 500 people. Thus, Anzac Day ceremonies, which is very big here in Australia, commemorating the Australian New Zealand heroes that fought during the World War, were cancelled. And further restrictions also are being implemented in terms of the aged care facilities. As we know, the elderlies are one of the very vulnerable groups that can be affected by COVID-19. So just to share the numbers at the moment here in Australia, the confirmed cases has reached to 709, with New South Wales with the highest number of confirmed cases at the moment, 307, followed by Victoria, 150, and Queensland, 144, while the rest are below 100 in terms of the numbers. Other observations at the moment, we'd like to tell everyone that in Australia there is no lockdown at the moment. However, there are various restrictions already in place. It's kind of business as usual, and as what Greg in New Zealand also experienced is the same here in Australia. The purchases of necessary toiletries for disinfection are being limited, and also some of the groceries, they have initiated opening earlier than the usual store hours to accommodate the elderly. They are also very much working very hard to replenish supplies, as recently poultry, meat products are also in scarcity, but continuously replenishing at the moment. But generally, especially here in our area, people are calm and practicing precautions. I think it is inevitable to stock up food as we really don't know what's going to happen. Schools are still open. There's no closing at the moment, though upon the initiative of the other private schools, some of them already closed, resorting to online resources to continue the education of the kids. But most of the people here are taking care of themselves. It's inspiring as we draw strength from the resilience of our young generation. Kids are being taught, educated as to what coronavirus is, and being thought of the context of why we need to further our hygiene practices, why we need to wash hands, why we need to cover our mouths using our elbows when we cough or sneeze. So simple things that we can do, simple things that we can control. These are some of the practices being applied here already by the residents here in Australia.
Thank you so much for all that information. Very informative indeed. Emmy Capilita Roja, reporting from Australia.
Yes, thank you so much, Alma. Back to you.
All right, thank you very much. Let's head on over to Seattle, Washington. Our EBC correspondent, Denden Fejeran, is standing by. Denden, how are you? All right, we'll get a good connection with Denden in Seattle, Washington after this short break.
When visiting the Philippines, Manila or Quezon City is a popular destination. But oftentimes the hustle and bustle of the city can be more stressful on your vacation. So when you feel the need to reconnect to nature or relax again, there's a beautiful oasis just outside of the city called the Garden at Ciudad de Victoria. That you can see here include hydrangea, snapdragon, and stargazers. They're truly beautiful. The gardens at Ciudad de Victoria are so peaceful, tranquil, and beautiful that it's become a haven for young couples and a very popular venue for engagement photos. The next time you want an escape from the big city, the garden at Ciudad de Victoria is a wonderful place to visit.
Okay, we now head on over to Seattle, Washington. Our EBC correspondent, Denden Fejeran, is still standing by. Denden, how are you over there in Washington?
Doing well. How are you, Alma?
I'm good. How are you? What is the situation over there on the COVID-19 situation?
Well, here in Washington State, the current statistic update, we have 1,376 positive cases of the coronavirus. 8 new reported death cases since yesterday, leaving us with a total of 74 deaths here in Washington State. Now, due to the continuous spread, Governor Inslee tweeted that he's putting a halt to elective surgeries and dental services that require the use of medical protective equipment, like masks, gloves, and so forth, as we would need to preserve all of this equipment for the healthcare workers as they work on the front lines of the COVID-19 pandemic. There are, of course, exceptions for emergency and urgent needs. Some of the banned procedures include, but are not limited to, are joint replacements, most cataract and lens surgeries, non-urgent cardiac procedures, cosmetic surgeries, some endoscopies, some interventional radiology services. Now, this order doesn't apply to patients with heart attacks, strokes, motor vehicle accidents. And just 2 days ago, Governor Inslee wrote a letter to President Trump. The letter states that Washington represents 2% of the American people, 20% of those infected with COVID-19, and 61% of the fatalities caused by COVID-19. Now, with the anticipation that things will worsen by the end of the month, like the hospitals will, we anticipate the hospitals be in crisis then. He actually wrote this letter to request from President to send us a U.S. Navy hospital ship, which thankfully would come with a full crew. Now, if President Trump does grant this request, it would just be another way to show the Washington people how much the federal government does indeed support us. And we could actually find more details on government.wa.gov. Now, what's nice, Alma, is that, and viewers, is that the people of Washington continue to be reminded of how we can protect ourselves from the disease. And one of the ways that is not being drilled as much as hand washing is actually getting plenty of rest. And a lot of people can do that now because there's a lot of people out of work, right? So to get plenty of rest, drink plenty of fluids, eat healthy foods, and manage your stress to keep your immunity strong. And what's really nice to go out into the community and to speak with my coworkers, how do you manage stress? Well, a Seattle resident, Len Laricio, she manages her stress by allowing creativity and reorganization flow in her household. So she's taking time to reorganize the home, focus on crafts like paper flowers for her upcoming wedding. And Len says, we're enjoying figuring out how things should look and how flowers will work together, pairing particular colors. So these simple discussions is actually really edifying the relationship between her and her family. And another thing that they like to do is go to the movies together. Now, no, it's not at the theater because the theater was actually closed down. So what they do is they log in, right? And they select the same movie and they're allowed to enjoy each other's commentary in a chat room. And Alma, we like to call this Netflix party.
I like that.
Me too. Yeah. I'm about to have a party tonight.
With all the negativity, the whole situation here, lastly, I would like to ask you, all those things you said is positive. What can you say? What can you take away from all this situation, this crisis? What takeaway can you?
Yes. Thank you for asking that question because this will really come from my heart, and I feel this every day, especially working with patients and still being out there in the field and meeting a lot of families. One thing I like to tell everyone that I come in contact with and we have this discussion is that the comforting thing to know is that we're all in this together, this pandemic. So no one is alone. And because of this, we're able to go back to basics, simply as washing hands. This is something that we learned when we were kids, right? So, back to basics in that sense, but ultimately, we go back to the homes. The distractions are removed, so now we have the time to really refocus on the things that matter to us most. We're going back to board games, we're bringing our families back into the kitchen to cook a meal together, baking, playing with our pets, taking our pets out for a walk, and it just really makes you think, where should I put my time towards? And maybe this is God's way of telling us, hey, we need to just not panic, remain calm, trust, and enjoy the blessings that come that's coming from this pandemic.
Thank you very much, Den. That is very uplifting, very insightful. Thank you so much.
You're very welcome. Den Feher in Seattle, Washington. We live in interesting times.
Over to Taiwan, where the total number of confirmed COVID-19 cases has increased by 8 to 108, according to their island's epidemic monitoring agency. Taiwan is credited with sharply limiting the spread of the coronavirus. No? Konti lang. And on the island is by pairing and analyzing electronic health and travel records of its residents. That's how they do it, along with enacting other emergency measures. We have our EBC correspondent there with us. On the line is Army Shu. Army, kumusta na dyan sa Taiwan?
Yes, Miss Alma. Okay lang po
Ay,
dito sa Taiwan.
Alma lang,
Wala pa
oo.
naman pong wala pang nagpapanik masyado. Bagamat may mga ilang groceries na nauubusan ng mga supplies. Pero okay pa rin naman dahil kanina nung galing ako sa grocery, ay naglalagay naman sila ng panibagong mga supplies sa mga shelves.
So walang panic buying dyan sa Taiwan?
I cannot say po na wala talagang panic buying. Merong konti pero hindi siya ganun katindi na nagpapanik yung mga tao. Mostly ang mga pinapanik nila, mga tissue. Hindi ko alam kung anong meron sa tissue, bakit sila nagpapanik sa
May
tissue.
tubig naman, ano?
Yes.
Bakit? Okay, so ang Taiwan, maliit lang ang cases nila, no? 108 lang. Kahit na pero for now, ano? Pero ano bang ginagawa ninyo?
Yes.
Bakit kukunti lang ang cases nyo dyan?
Maybe, Miss Alma, nakaka-help yung ginagawa nilang mass rationing. So hindi nagkaroon ng panic buying ng rationing, ay ng mask kasi ang ginawa ng government ay nilimit ang bawat tao ng 3 masks per week. And by using the health card, hindi sila pwedeng magdoble ng pagbili ng mask.
I see. Hindi
Yes.
pwedeng doblehin. Okay, so wala palang lulusot
hindi
doon.
po.
So that's one of them. Ano pa yung iba?
Yes, yes. Maybe
Disinfection din,
yung
ganon.
mga thermal temperature, mga ginagamit sa every mga establishmento, even mga schools or mga groceries, even 7-Eleven, like that po. Saka bawat entrance ng mga business establishment ay may mga disinfectant po na pwedeng magamit. And even the toilets, public toilets, there are.
Kumusta naman yung mga kababayan natin dyan? So hindi naman sila masyadong stressed because of this situation? O kung siguro man dahil because of what's happening here in Manila, no?
Yes, Miss Alma, yung may mga kamag-anak dyan, doon sila medyo nababahala kung ano na nangyayari sa mga kamag-anak nila. But so far dito ay okay pa naman. May mga nakikita pa rin akong mga namamasyal, pero they are wearing mask. And sa company, they are providing mask every day, 1 piece for them.
So may extra mask pa pala kayo dyan. So hindi stoppage of work, no stoppage of school. Life goes on dyan sa Taiwan.
As for now, ay wala pa naman maliban lang doon sa napabalita last 2 days na may isang affected, but hindi the full company ang shutdown, kundi yung mga nakasalamuha lang, 14 days quarantine, and there are some schools na nag-o-online studies na lang.
Okay. So
Yes.
nag-ano din pala sila. So may mga nag-close na schools and they encourage online studies na lang or
Private
online
schools,
learning?
yes, private school, but public school not yet.
Not yet. So far, okay naman pala kayo dyan. Hindi naman na ganun
Yes, Ms.
ka.
Alma, but they are offering now na they are studying po na baka all the schools, maybe they are going to study online na lang muna para maiwasan yung pagdami, para hindi na dumami yung mga cases natin dito sa Taiwan.
Army, meron ka bang masasabing advice para sa amin dito sa Manila tungkol sa situation or sa mga nangyayari ngayon? Meron ka bang masasabing positive? Ano pang matututunan natin dito? Lastly, sa akin
Sa
na tanong
experience
sa'yo.
ko, Miss Alma, ang ginagawa ko, hindi ako nagpa-panic buying. Ang binibili ko yung mga pwedeng itanim.
Yan.
Oo, kasi yun, fresh from the garden tayo, yung mga mabilis lang tumubo. Hindi natin kailangan masyadong mag-hoard ng mga pagkain or ano man dyan.
Oo.
Yung mga necessary lang. Mga necessary lang. So yun yung isang ginagawa ko rito sa bahay. Nagtatanim ako. Every day, I plant para pag nag-harvest ako, every day ako may maka-harvest.
All right, thank you very much, Army. Such a very good advice. Ayan, dapat gawin na rin natin ngayon lahat yan.
This is Army Shu, and we live in interesting life.
Thank you, Army. Ayan, maraming salamat. Thank you all to all our correspondents from all around the world. And thank you for joining us today. Stay updated about the COVID-19 situation going on around the world now. I'm Alma Angeles, and indeed, we live in interesting times.